They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
Carle is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carle, with Health Alliance, is always at the forefront to help you thrive.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HS St. Anthony's Memorial Hospital.
Hi, I'm Keanne Armstrong, your host for Being Well, and I'd like to thank you for tuning in today. Today we're going to be talking about walking. There has been some new research that just came out, and it's going to be discussing the health benefits and why walking is important and everything associated with that. Today I have Dr. Colleen Moore, a vascular surgeon with Prairie Cardiovascular in Springfield. Is that correct?
Correct.
Well, thank you so much for joining me today.
Nice to be here. Thank you.
So let me ask you a little bit about yourself and how you got interested in vascular surgery.
When I was doing my surgical residency training, I found vascular surgery to be very interesting. It's a technically demanding field that covers a broad range of disease processes and procedures that we can do. And so I found it to be the most interesting for those reasons.
So it obviously has something to do with walking. That's what the research is that we're going to be talking about today.
Correct.
So do you want to jump right into that? Do you want to talk about the research? Do we need to talk a little bit more about vascular? What would be the best way to open this up?
So some people don't know what vascular surgeons do, and we're often confused with cardiologists or people that take care of the heart. Mm-hmm. And that is not what we do.
Okay.
As a vascular surgeon, we take care of all of the blood vessels outside of the heart and the brain. So we operate on the neck, the arms, the belly, and the legs, which is where the walking comes in today.
Okay. Well, let's talk about the walking a little bit. What research is it that has just come out that's so important for folks to know about?
There was a study done on about 16,000 women. They were all part of a previous study looking at cardiovascular risk reduction for people that took aspirin and vitamin E. And at the end of that, they offered them the opportunity to participate in this. And they gave them each an activity monitor, and they wore it on their hip, and they wore it for about a year. And then they went back and downloaded that information and tracked how far they walked and associated with that with their mortality. And they found that if you walk 4,000 steps a day, you have an increased longevity compared to your friends that don't walk 4,000 steps a day.
So the average we normally hear is 10,000. So really that's kind of not the going thing these days?
So in terms of longevity, you need to make a minimum of 4,000 steps. The more you walk after that, up to about 7,500 steps, you continue to increase your longevity. The more exercise and activity you get, we know that decreases your cardiovascular morbidity. So you get fewer heart attacks, fewer strokes, fewer symptoms of blood vessel disease in your legs, and so that helps as well. So you need to make a minimum of 4,000, but the more you get, probably the better you will be.
Well, yeah, that makes sense. The more exercise you get, it's always better, but I think folks out there might think, hey, 4,000 steps, I've got my steps in, but the more they do, why not?
The better you are.
Yeah, absolutely. Well, how did this study come about? What I guess sort of was the shoot-off point on why we needed to see if more minimal steps was
So to date, there's been research on walking that looks at reduction of risk, but nobody looked at walking and in terms of how much walking is really necessary to live longer. And so they had these women that had already been gathered for one study, and they decided to offer them the opportunity to do this. And so they looked at this, and this is one of the first studies that's been done that actually looks at walking in terms of whether or not you actually live longer.
Okay. So does this pertain to men too?
The study was only women. We know men have similar, if not more aggressive vascular disease, and so we have sort of extrapolated those results to the men, and if they can walk as well, they should get some benefit. But to date, there's been no study specifically looking at men.
Okay. Well, when we're talking about walking and folks who may think that they don't know how to start about getting an exercise program going, should they just walk? Is there more things that they need to do? What's the best route to take when you're looking at forming an exercise program for yourself?
It's fairly simple. One of the easy things we ask people to do is to get some sort of activity monitor, and it doesn't need to be a really expensive watch or something like that. It can be as simple as a little $2 pedometer that you just clip on your waist. And wear that for about a week or two and track how far you go. And then you get a baseline, and then you add about 500 steps a week. And if you can add 500 steps a week, which is basically an extra lap around the house, an extra walk to the mailbox, nothing huge or big, but just a few extra steps a week, you'll get your activity going. Some people are very daunted by the fact that they're told they need to walk for 30 minutes at a time. And people are busy, and sometimes it's hard to get 30 minutes at one setting. So you can try doing small 10-minute walks. If you do one after breakfast, one after lunch, one in the evening, adding 3 10-minute walks gives you more than the steps you'd need to fulfill that requirement.
Time does seem to be a factor these days, and you think, oh gosh, I got to get this done, I got to get that done. When am I going to fit this in? But sometimes, I mean, even here at work, if we just get up and walk around the building sometimes, you feel a little bit better after you get up and move.
Correct, and that's one of the things, one of the strategies the American Heart Association and other people have asked or have tried to implement is if you're at work and you have a meeting with 2 or 3 people, start a walking meeting where you walk around the building while you talk rather than sit at a desk all day. The other thing is if you want to walk during work, make it an appointment on your calendar. So I'm going to walk at 11, and if somebody calls and says I need to meet at 11, you have an appointment already, and so you make it part of your day. The other thing is to park farther away. Everybody likes to park right next to the door. If you park at the end of the parking lot, you add 50 steps in and 50 steps out, so there's another 100 a day.
Or maybe looking at the elevator versus the stairs.
Correct. You can do that as well, or using the bathroom on the other side of the building.
Well, it sounds to me like it's kind of a choice type of thing. It's like eating healthy. Do I want this to eat? Do I want that to eat? And the same thing with making your life easier, parking closer, taking the elevator, add the extra steps because it's going to be a benefit.
Correct. And there are a lot of benefits to walking, just aside from living longer. It benefits your blood pressure. We know that your blood pressure can lower a little bit with better cardiovascular health. It may never get you off your medications, but maybe reduce them. If you're a diabetic, we know that walking decreases your blood sugars 2 hours after you eat. So if you can walk after a meal, even a short little 5 or 10 minute walk, your blood sugars will be lower, and that'll help you get your blood sugars better controlled, which has a host of health benefits. We know it lowers your cholesterol. It helps your heart health. It helps your lung health. So walking does a whole bunch of things aside from just making you live longer.
Yeah, good to know. Now, does it matter? It doesn't sound like it matters what time of day you walk, or...
It doesn't. You can walk whenever, and people find, I'm an early morning walker, runner, so I get up early in the mornings, and if you're going to do that, we ask that people lay your clothes out at night. Make sure they're all laid out sort of in the order you put them on in, and then when you get up in the mornings, you don't fumble to look for things, you're not missing your iPod or whatever it is that you listen to while you walk, and so you're more inclined to get out the door and go. Another thing is if you can find people to walk with, that they hold you accountable and you're not going to let your friends down, so while you may not feel like it, if everybody's waiting on you, you're more inclined to go.
Okay. Does it make a difference walking versus walking on a piece of equipment like a treadmill or something like that? Does it matter?
It doesn't, as long as you're moving and doing something. And there are some people who either they have joint issues, knee issues, hip issues, back problems, or they've got some other mobility issue where they really can't walk. We have found, and this study didn't specifically address that, but we have found that in other cardiovascular studies, if you can ride a stationary bike, if you can row, or if you can use, in cardiac rehab, patients use the arm bike. If you can do that and get your heart rate up a little bit, that offers a lot of the same benefits without walking.
Okay. So you said that you work on all the different types of veins and arteries outside of your heart and your brain, correct? So a number of arteries and veins are in our legs. What are some different things that you work on with the legs?
So people will typically come see us because they have trouble walking. So they'll go to walk, and it's typically every day at 100 yards, 200 yards, their calves start to feel like they're cramping and you have to stop and rest. And typically that means there's some blockage in those blood vessels in their legs and they just can't get enough blood flow when they need it during times of exercise. And so we can take pictures of those blood vessels, we can put balloons or stents in them to open them up. If they're completely blocked, we can operate and basically build a new blood vessel around that area of blockage and get them new blood flow down their legs and help them walk more.
Okay. Something I've noticed even here at work, a lot of people stand at their desk these days instead of sit, or they may sit on a ball instead of a chair. Is there any tips that you give people on maybe how much they should stand versus sitting a day that would be good for your legs?
So we know that standing actually benefits your legs in terms of you tend to shift your weight more when you're standing, and when your calf muscles move or contract, they help move the blood through the veins to get that out of your legs, and so you tend to have less swollen legs, you have less incidence of varicose veins. As long the arteries, the standing doesn't help, it's the actual moving, but the standing does help your veins quite a bit.
Okay. I'm watching one of our producers move their legs around a little bit. I think he's getting the picture over there. So what about for folks who do have some joint issues, knee issues, hip issues? Maybe they're thinking, no, I just can't walk very fast. I can't walk very far. How is this really going to benefit me?
So if you can walk any is better than none. And then like we said just a bit ago, that if you use some of the other equipment, if you can find something that works for you just to get your heart rate up, that will help. That decreases your risk of heart attack, your risk of stroke, and so rowing machines, stationary bicycles. Some people like I know a lot of older individuals like the recumbent bikes, and they'll take them, around town and bicycle that way. That works. The arm bikes work. Just anything you can do to sort of get your heart rate up a little bit. May not translate to 4,000 steps for you, but we're not sure if that 4,000 steps is an absolute step requirement or if that's because they got their heart rate moving a little bit.
Okay. Talk to me about something called peripheral artery disease. Why is that important to know about? So
peripheral artery disease is what we just mentioned that a bit ago, and that's where you go to walk and you develop calf pain. And the minimal symptoms are calf pain that you sort of have to stop and rest to make it better. If untreated, it can progress to where people will develop sores on their feet or their ankles that don't heal because they don't have enough blood flow. So if you're having symptoms of peripheral vascular disease where you go to walk and your calves start to cramp, or you can't get up those hills, or you have some difficulty walking that you think is related to your calf muscles and not so much your knees or your hips, it's reasonable to talk to either your primary care doctor or somebody about getting referred to somebody who can take care of that for you. Okay. What are some signs and symptoms that may lead somebody to see a surgeon such as yourself? Do they need to look at their veins, or do they need to consider pain that they're having? What are some things that people need to keep mindful? We like to see people, if you've ever had a symptom of a mini stroke, so if you've ever lost vision in an eye, if you have an arm or a leg that doesn't work, if you've had an episode where you couldn't speak, those are things that may be referred to a vascular surgeon. People with pain in their legs when they walk are referred to vascular surgeons, and we also take care of aneurysms. The unfortunate part of this is a lot of this is found rather incidentally. Some of it doesn't have a lot of pre-existing symptoms, so you just need to make sure your primary care doctor is aware of any new symptoms or new problems you may have, and they will get you to the right people. Okay. Are there things with people's legs? I know varicose veins. People see varicose veins in their legs, which are very visible. Are there things that may be happening with their veins and arteries that maybe people can't see that they need Most
to pay more
arterial
attention to?
disease you cannot see.
Okay.
The overwhelming majority of it has no visible symptoms of anything that you may see. Occasionally, people with vascular disease in their legs may develop, you'll start to lose the hair on your legs. You may develop redness in your feet, and those may be some subtle signs.
Okay. Now, what does cause varicose veins while we're talking about that?
Varicose veins are caused, the veins are set up and they have little valves in them that when your heart pumps, those valves open and the blood should move up to your heart. When you have varicose veins, those valves either have, for some reason, have gotten stuck, they don't open and close correctly, or the vein has gotten stretched out, and when they close, there's a gap and the blood will sink down in them, and then the veins in your legs get distended and become high pressure, and they develop varicose veins to relieve that pressure. And so we can treat the underlying venous problem to make those veins go away.
Okay, that's interesting. People, I think, a lot of times are very self-conscious if they, their legs have varicose veins, or they're thinking, I just want to wear pants all the times and things like that. But really, it's more about the health and the way that you're keeping your legs in shape and walking and doing all these different things that really should matter to a person, it sounds like to me.
Correct. And varicose veins, while unsightly, can cause some medical issues. Walking actually helps your varicose veins. The more walking you do, that increases the blood flow out of your legs and helps decrease your swelling and symptoms from those varicose veins.
Okay, so do you also work with folks who have diabetes? Because it seems to me that I hear a lot of people have issues with legs and feet and things like that if they have diabetes. Is that something that you see people about as well?
We do. A lot of diabetics will develop vascular disease, and so that is part and parcel of their disease process. In fact, we have noticed through some studies that many people will present with blood vessel disease long before their diabetes is diagnosed. And so there seems to be some precursor that affects the blood vessels sooner than actually you're diagnosed with diabetes. And so if you are a diabetic, you need to keep a very close eye on your arteries and your veins, and make sure you're examining your feet to make sure you don't get ulcers on them or sores on your feet. And if you have any symptom that you think might be related to your blood vessels, get to see someone.
Okay. Now, when you said blood vessel disease, how do you know when somebody has a blood vessel disease?
They can develop the sores and ulcers. They can develop calf pain when they're walking. Some physicians will order testing that will give you a number of how much blood flow you have in there, and so we follow those numbers, and if they get to certain thresholds, then most people are referred to a surgeon or someone else who specializes in blood vessel disease.
Okay. A friend of mine who is a hairstylist stands a lot on her feet all day, and she was having a lot of leg pain, and she got to talking to me one point about how blood was pooling in her veins and it wasn't working right. And a lot of what you're talking to me about today sounds like something that could affect folks in that position of a career.
Correct. And people like hairdressers, teachers, other people who stand on their retail, waiters and waitresses. I tell all the nurses at the hospital who are on their feet for hours that they should be wearing compression stockings. And those are socks that fit a little tighter than your regular socks, and they help keep those veins from collecting all that fluid and from your legs swelling. And most people, if they wear those, will notice at the end of their shift or later in the day, the socks start to get real tight, and that's when the legs are starting to swell, and those socks are squeezing that out. But they also have significantly more energy, and they feel better at the end of their shifts because they're not lugging around these big, heavy legs all day. Mm-hmm. That decreases your incidence of varicose veins and can help your arteries as well because you feel better, so you tend to walk more and move around more.
Okay. Now, does it matter what kinds of shoes a person wears when they're walking, or just in general? You hear stay away from flip-flops, they're not good for your legs, not good for your feet, things like that. And we're not endorsing one type of shoe or another, but I mean, is it better what you wear on your feet? Does it matter?
I don't know that it matters when you're walking. I think you need to wear a pair of sturdy shoes that are comfortable. We typically tell the diabetic patients we don't want you walking in open-toed shoes like flip-flops or something like that, because those you can injure your feet, and they sometimes don't realize that, and then once they've got a sore, things can progress kind of rapidly. So we'd like you in a sturdy shoe that sort of protects your feet while you're walking, because the pavement can be uneven and those kinds of things. So it doesn't matter what shoes you wear as long as you're wearing shoes.
Okay. Well, we've talked about the legs a lot, the lower extremities. What about your arms, your hands? What types of things should people pay attention to when it comes to their veins and arteries in the upper area of your body?
Some people will develop tightening of the blood vessels to their arms, and that's not very typical, but it can happen. And those people will develop symptoms when they go to drive, and arm will continue to go to sleep. they'll notice that if they take the blood pressure in their doctor's offices, one will be significantly lower than the other. And people always like to use the low side because that seems to be a better number. Actually, you should use the higher side because that's probably the more accurate blood pressure. And if you can't work above your head, if you can't wash your hair, if you can't get things out of the cabinet because your arms go to sleep, those are things that probably need to be referred to somebody that takes care of blood vessels.
Okay. Well, speaking of that, what about someone who complains about having their arms fall asleep a lot at night when they're sleeping?
That can be related to a nerve compression issue in your neck, and it's real hard to get people to sort of change how they sleep. But those things are typically seen by physical therapists first, and they do some strengthening exercises. As a sort of a last ditch, we can offer some surgery to sort of decompress those nerves in the neck. But we usually have them go through a physical therapy route first. We try to sort of modify how you sleep. But those things can also be treated by a surgeon.
Okay. You mentioned earlier a number of tests can be done. Are blood tests more showing than some tests may be? Do you need to do like ultrasounds, CAT scans, things like that? What's the best route to find out exactly what's going on with a person's veins and arteries?
Most surgeons will use ultrasounds first, and they're very simple tests. The easiest one we use to look for blood flow issues in your legs is we put a blood pressure cuff around your ankle, and we take the blood pressure in your two arteries in your foot. And then we take the blood pressure in your arm and we compare the two, and we like them to be very similar. And the lower your ankle blood pressure is compared to your arm indicates how severe your blood vessel disease is. That's a very basic, easy test that anybody can have done. And then we would follow that up with whatever tests are appropriate based on that number.
Okay. We have a couple of minutes left. What haven't we covered that you think viewers need to know about?
I think it's important that along with all of the health benefits we talked about with walking, people need to be continually aware of the risk of stroke, especially if you have diabetes or other cardiac disease, and you need to make sure that you are watching people for strokes. And if you develop any symptoms where you lose vision in an eye temporarily, where you suddenly have an arm or a leg that goes numb or tingly or doesn't work and comes back, in a period of time, or if you lose the ability to speak to somebody, if it comes out either garbled and jumbled or it's just very nonsensical, those are symptoms of a stroke and should probably be evaluated rather quickly. And then depending on what that shows, you would be referred to a surgeon.
Okay, so if somebody notices somebody who's having some difficulties and they're unsure whether it's a stroke or not, what are some tips that you can give some people who might notice that? Or if it's happening to someone themselves, what do they do?
Call 911 first. If you notice something that you think may be a stroke, you need to get to an emergency room as quickly as possible. Things you may notice in someone else is that part of their face begins to droop. Their face doesn't look the same on both sides, and that one side will sort of sag, and that can be part of a stroke as well. So if there's any question, you are better suited having it evaluated than sitting at home waiting for something bad to happen.
Okay, so call 911, don't wait, just make sure that you're getting your loved one taken care of.
Exactly.
Well, some really interesting information today. It's good to know about the new research and study that's out. Do they have any plans on doing a study with men, do you know?
I don't know about men, but they were there were a couple offshoot studies since they found this information that should be coming out. This one ran for 4 years, so I expect, it'll be a couple years before we hear more, but they did have plans for additional studies on walking and how it benefits you.
And you should probably start at an early age too.
The earlier you start, the better you are.
All right. Well, that sounds good. Thank you so much
Thank you very much.
all of the information that you've shared with us. And we hope that you have enjoyed today's topic about walking and the benefits and getting your 4,000 steps in each day. We appreciate you watching, and we'll see you next week.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HS St. Anthony's Memorial Hospital.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.